It's time for our new segment on the Vine, Medical Mondays with Baptist Health. If you have sleep apnea, you are at risk of developing obstructive sleep apnea. And I sat down with Allison Debooserie, a PRN with Baptist Health Weight Loss Center, to learn about how this can impact your overall health. Take a look. So what about obstructive sleep apnea, or OSA? What exactly is that?
So it's just what it sounds like, obstructive sleep apnea. When people go to sleep, they have things that get in the way of their upper respiratory tract, and it causes them to have pauses in their breathing while they sleep.
So how do people know if this is something they have? Is it usually maybe someone like a spouse that's like, hey?
Most of the time the partner is like, look, you need to go get tested. But it's a lot of loud snoring, irritability in the daytime. People will wake up with headaches, and they just feel overall fatigued. They don't feel like they've gotten any rest.
And sometimes don't even know why they feel that way? Mm-hmm. Really?
And they think it may be hormones or different things, and they just don't ever think, oh, it's my sleep.
Yeah. Mm-hmm. And so what are some of the causes of this?
So our big one that we talk about is obesity, but there are other things like jaw structure and enlarged tongue, tonsils, adenoids, all that kind of stuff that can get in the way.
Yeah, so if this is something that people think might be happening to them, what do they need to do about it?
So I would recommend going to see their primary care provider, asking for a sleep study. There are questionnaires, and you'll fill it out, and if the doctor or nurse practitioner feels that it's warranted, they'll get you set up with a sleep clinic to get a sleep study done.
So what does that look like, a sleep study?
So there's different types. There's ones that you can do at home. There's ones that you can do in a facility and actually have providers watching over you. But it kind of just depends on insurance requirements and stuff like that.
Mm-hmm. And you all can help with this here, right?
Yes. So we are mainly focusing on the obesity and helping people lose weight. So we use medications like GLP-1s to help people lose weight effectively, especially if they have insulin resistance like type 2 diabetes and things like that.
Yeah, so you see it helps a lot. I mean, just the weight alone.
Yes, because people don't really realize how much weight they have in their shoulders and their neck, and when you lay down, that all kind of rises up and can obstruct your airway.
Yeah, so a lot of times we think, oh, just the snoring maybe comes with age, but no, weight comes with age sometimes too.
Yeah.
So it all kind of...
You can be 27 years old and you could have sleep apnea.
Yeah. Okay, so if people want to come and make an appointment, it's easy. Just call, make the appointment, or do you have to be referred?
Some insurances require referrals, and so I would say just call us and find out first, and we'll get you scheduled, or we'll get the referral, or whatever we need to get you seen.
Yeah, so it's important to go ahead and do that, because I mean it really affects your quality of life in a lot of ways.
Yes, and our program is individual, where we go through the prior authorization and the appeal process, so even if you don't think that medication may be covered, we'll work with you and try and see how we can help you lose weight.
Is there a certain weight that people really start seeing these type of symptoms? They're over, like, what is it, 20, 30 pounds? Or?
I usually tell people if your BMI is 27 or greater, then you're starting to get into the overweight, obesity, morbid obesity. So it just kind of can spiral out of control. Even when you think that I'm not overweight, you may qualify.
Oh, well, this is great information. Get better sleep and find out more details by going to the website and make that appointment. All of the details are on the screen. Thank you so much for sharing this with us
thank you for
today.
having me.